Sports Pharmacists. It's Ashley with the International Sports Pharmacist Network. This evening, I have with me Athena Cannon. I am so excited to have her join me for an interview because she has done so much for the world of sports pharmacy in the United States. Welcome, Athena.
Hi, Ashley. So excited to be talking with you.
Thanks. I really appreciate your time to do this. So if you wouldn't mind, tell us a little bit about your current position. What are you doing for work?
So I'm currently a second-year pharmaceutical care leadership resident with the University of Minnesota. This program is focused primarily on ambulatory care and leadership, as well as academia. And so I spend most of my weeks in a clinic where I'm working with providers, managing chronic conditions. And then I spent some time teaching at the College of Pharmacy. And last year, I spent some time doing some advocacy with the Minnesota Pharmacy Association.
That's amazing. That's really diverse. I mean, you have a lot of things that you're involved in. And I feel like anybody who has tried to research anything in sports pharmacy has probably come across your name. So tell us a little bit about how you got into sports pharmacy. What's your path?
So I've done a few interviews where I've kind of gone through my journey. And so you can go to one of the main ones where I walk through is the 21st Century PharmD. I do an interview with Brooke Griffin on that podcast. But in short, it started when I was a first-year pharmacy student. I had a curiosity about if athletes are special populations and if there are special considerations when pharmacists are caring for them. And I spent about the last 5 years trying to answer that question for myself and for athletes and for other pharmacists. And so since then, I've worked a bit in anti-doping. I've gone to major conferences, but for the partnership of clean competition, so still kind of focused in doping, but I've really started to expand into the clinical sense in sports medicine. How can pharmacists be utilized within the medical team that works with athletes? So physicians, athletic trainers, coaches, dietitians, sports psychologists potentially. And so I'm really focusing on the interprofessional side of things. And at the same time, just like you, and in collaboration with you, growing sports pharmacy in the United States by founding the U.S. Sports Pharmacy Group.
Yeah. So I completely agree with the approach of integrating the pharmacist expertise into what the athletes already have established and integrating it into sports medicine practice. So since you've been looking at this question over a couple of years now, are athletes anything special when it comes to being patients?
Absolutely. I think there's a lot of things that people overlook with athletes. What I thought before I started diving into this area is that athletes are healthy. They take no medications. They have no medical concerns. And so why would a pharmacist need to be involved in that care? But ever since being on the outpatient setting and being able to see either actual professional athletes come through or, just your everyday person who runs marathons and is very passionate about health and fitness, you start to see that they have conditions that can be managed chronically with medications. They're on many medications or they're taking dietary supplements. And for me, I feel like anytime there's medications or dietary supplements involved, pharmacists can be a part of the greater team to share our knowledge and to care for those patients.
Yeah, excellent. And as you know, from working with me when, I was doing training with you in anti-doping, I always told you, take off your pharmacist hat and put on the athlete hat. And, look at it from their perspective and really try to put yourself in that position of how is this medication going to be used and can it be a bridge back to health or when can I return to play? And you're going to be asking different questions than if you would from the pharmacist side of things of, the most appropriate use and sticking right to that black and white picture. But so working in your clinic setting, what have you found to be your biggest impact? Do you have a story you could share with us?
So for one of the clinics that I worked with throughout my residency program, we had a sports medicine physician and an athletic trainer come in for part of the week to do their sports medicine clinic. And I found the most helpful that I could be with that sports medicine provider is to really know more about all of the medications and seeing the patient as a whole, as opposed to really focusing on the sports medicine injury that they're coming in with, or potentially the medications that they're using to treat that sports medicine injury. For instance, the provider consulted me to really look over their hypertension medications, even though they were being seen for musculoskeletal injury. And so I was able to do comprehensive medication management, looking at all of their medications, identifying if the medications were indicated, safe and effective, and then if they were having any adherence issues. And then the patient was ultimately able to follow up with me, really to focus on hypertension. So even though they were an athlete, they were coming in for something else, I was able to come in to see the patient as a whole.
Yeah. And, that's an excellent example, because sometimes you'll run across those people who are maybe a recreational athlete, and then they decide to sign up for an event. And you, as a trained sports pharmacist, can recognize that maybe the blood pressure medication that they're taking is prohibited in competition or a banned substance. So I think that's a great example to use in this case. Yeah. And then lastly, what do you see as the future of sports pharmacy?
Oh man, I think it is such a new field. And as you know, Ashley, since we've started this, you longer than I have, but since I started about 5 years ago, I have seen it grown into things that I had no idea it would grow into. And so I'm excited to see where it's going to go, and see many of the pharmacists start asking the same question that I did, or seeing their role when it comes to athletes' care, either in anti-doping or the clinical side. But ultimately, I think for me, my goal would be to continue to create some sort of network in the United States where pharmacists can consult with each other and teach each other, and really just support kind of this creative endeavor that we're all on, because it's really tricky when you're trying to do something new that really hasn't been done widely before. And then learning from our international colleagues as well through the International Sports Pharmacy Network is going to be really vital in that.
Yeah, absolutely. And that we're always there to support you as well. And we're always seeking out interested people. We think that any pharmacist could potentially aspire to be a sports pharmacist. And as you know, that's the goal of ISPN, is to create that network that allows pharmacists who are interested in this to do the same thing as part of their current job. So I really appreciate your time today. Did you have anything else you wanted to share with us before you go?
I think that's it. Just know that, whatever you're curious about in pharmacy, try to ask those questions and try to find your role, because I think pharmacists we have so many skills, and there's so many things that we can positively contribute to. We just got to kind of, take the step to do that.
Mm-hmm. Yep. And I would encourage those watching to look more into what Athena has put out there. She has been wonderful at trailblazing, and she's truly persistent when it comes to trying to understand how pharmacists can fit into the sports medicine system, and really been a trailblazer. So thank you, Athena, for all you've done. I appreciate your passion.
Thanks, Ashley, for having me.
Yeah. And for those watching the video, please like this video, subscribe to the channel, and share it with anyone who you might think benefit. Thank you.